What was really cool opportunity for us as an entrepreneur, as an innovator, any type of policy change, you have no choice but to look at it as an opportunity. Some kind of wall is being torn down or some kind of door is being opened where solutions need to fill the gap. It can be people, it can be technology, it can be all types, it can be procedural. So we have no choice but to look at policy change as an opportunity.
That spark of innovation, it's just waiting for the perfect combination of tools and talent to bring it to life. Welcome to Pitch, Build, Scale. I'm your host, Chris Fanchi, a recovering startup founder, veteran SaaS marketer, turned dev tech enthusiast and growth specialist. Each episode, we connect with the builders, the visionaries, and the problem solvers who are redefining what's possible with today's technology and pioneering the websites, apps, and software products of tomorrow. These are the conversations that transform how we build, how we sell, and how we scale technology businesses in a world where the tech evolves by the minute. Ready to stay ahead of the curve? This is Pitch, Build, Scale. Hello and welcome to today's episode of Pitch, Build, Scale. If you're new here, we are Big North Marketing, and we specialize in helping dev shops and SaaS companies scale their revenue. So if you want to learn how to take your SaaS or dev business to the next level, make sure to stick around. And if you're interested in a free growth consultation, just drop us the word growth in the DMs. We're really excited to have today's guest. Cody Pittman is the CEO of Duett, a platform that helps care coordinators match Medicaid-eligible seniors and people with disabilities to the right in-home service providers, faster, easier, and with better outcomes for everyone involved. Cody, welcome to the show.
Hey, thanks for having me, Chris.
So to get started, I always like to ask my guests, what is your journey into technology? When did you first become interested in tech, and how did you end up where you're at now?
Yeah, so that's a great question. I would say that my path would be very difficult to emulate. I have the opportunity to mentor college students, and they tend to pick me to be their mentor because I've had some interesting turns in my career, but that also comes with difficult to emulate. I'll go probably further back than you really wanted, but it helps to make the point, which is I majored in Chinese and marketing in college. So Chinese major, marketing minor, and which is at the time I thought my life was going to be public service, whether it was military or another agency for the government. But after living in China for about a year after graduating from college, I was like, this is not what I want for myself and for my future. It had a little bit to do with relationships. The girlfriend I had at the time is now my wife, and long distance and all that was a part of it. But it was also the career path just didn't feel interesting to me anymore. And so I moved back to Indiana, and then I found my way to Santiago, Chile. And at the time when I first moved to Santiago, I was teaching English as a foreign language. Now, when I say that, a lot of people think I'm teaching 10 to 15-year-olds in a school setting, but what I was actually doing was teaching English in a corporate setting. So the company that I worked for had a couple of teachers, and we would go into corporate office settings. And so we were like, one of my clients was a major mining operation. And so I was teaching Chilean executives English so that they could better interact with their American and Australian and English counterparts. And so I was kind of going into 5 different offices at the time and doing all that. However, there's a program in Chile called Startup Chile, and it's kind of like an incubator. It's federally funded from the federal government standpoint of Chile, but what they do is they deploy $40,000. I'm pretty sure it's $40,000 to each startup that comes and joins the incubator. And so I'm not joking that I got into technology and startups because I was riding in an elevator one day, and I was like, why are there so many foreigners in this elevator with me? And so I asked them, I was like, hey, what are you guys all doing here? This is not the most touristy place in the world. And they answered me. It's like, hey, we all run our own startups and we're a part of Startup Chile. We're here for a couple of months working on our startups. And so I started asking those questions. I started seeing these guys more in the elevator or around our neighborhood in Chile and in Santiago. And eventually a week came where I was like, teaching English is super fun. It's interesting. I'm meeting very interesting people, but I do need to start my career from a professional standpoint. I was not going to be a teacher forever. It wasn't my passion. And so I essentially ended up lining up about 4 interviews with all of these startups that were all there for Startup Chile. One was essentially kind of like an art dealer website where it kind of put the power in the hands of the artists rather than, studios or it essentially allowed artists to get discovered. It was kind of like a social media marketing website for artists to get discovered.
Okay.
One was an app that made meeting up to play soccer easier, so you could go to any city in the world and find a soccer game to play in. Which I ended up not taking that job, but I ended up using that app socially to find soccer games to play in multiple countries that I visited. But the last one was the job that I ended up taking, and it was at the time we were working on an app called Scholaroo. It was a way for students to find scholarships for college in the same way that somebody might use Tinder or a dating app to find a significant other.
Wow.
Essentially, the idea was, can we give a high school student between last period of English and before going to soccer practice, they've got maybe 15, 20 minutes. Can we give them a way to search for scholarships while they've got some downtime? And then we worked on that for several months while we were living there in Santiago. And then during that time, we also started realizing we're pretty good at marketing other people's startups, other people's apps. And so unfortunately, what that meant was we parked Scholaroo on a shelf and we opened a digital marketing firm and we started helping other startups with their marketing, their user generation, their SEO, their early stage marketing practices for businesses. We moved that company to San Francisco, where naturally we started to get more and more startups, more technology firms coming after our services from a marketing standpoint. And so I didn't get into technology myself until I became the CEO of Duett. But in that time, I was with the marketing firm for about 10 years.
Hmm.
And in that time, I had several roles. Well, one, I was the first employee there. So I did everything the CEO didn't want to do. So I was a marketing executive, I was executing campaigns, but I was also in operations for our own firm. And so, what are the suites of technologies that we're using to execute our work, whether it's project management or emailing systems or whatever? How do I make us more efficient with technology? So it got me into a lot of software solutions, more from an internal application standpoint. But our clients tended to be on the cutting edge of whatever industry they were in. And so, as an example, I had, wearables really kicked off. I was at the PR firm for 10 years and I've been doing Duet for 5 years. So I started there about 15, 14 years ago.
Mhm. Mhm.
At the time, wearables were really kicking off. And so some of the more cool, interesting projects we worked on was like one that is still in the market now is Aura Ring, the wearable ring that people use for sleep tracking and all types of stuff.
Mhm.
We also had clients that I'm a father now. And so we worked on a wearable technology for literally newborns. Now it wasn't wearable like a Whoop or an Aura Ring, but it was something that could be clamped to a infant's clothing, but it had enough sensors on it to measure movement, body temperature, sound, and things like that. So,
Huh.
give parents peace of mind when they're bringing their child home, getting a technology readout like, hey, your baby's temperature is totally fine. They're sleeping great. Their heart rate's normal. Their
Yeah.
movement's normal during sleep stuff. And so those were wearables, but we also did things like drone technology. I had several companies that were in drones in one way or another, whether it was software or hardware. We had a geospatial mapping company that was doing really cool stuff. And so over those 9 years, one, I transitioned from executing the campaigns on behalf of our clients to being more on the sales team. So all of these startups were coming in. I say startups for the sake of our conversation. We had other clients too, like Mercedes and Budweiser and Milkbone and things
Mm.
like that. But our technologies and our startups were obviously the most interesting campaigns because there's just new products, new things that nobody's ever seen before.
Yeah.
So in that line of work, as a salesperson, I was less focused on executing campaigns. I was still participating in building the strategies, but less focused on executing them. What that meant was I got to anytime somebody came inbound to our website looking for services, I was the first call. So I got to talk to them and hear about what they're doing, how they did it, how they came up with the idea, what they need to do to get to their next level. Some of them were completely bootstrapped. Some of them were Series B, Series C funded startups, like millions and millions of dollars raised, and some had $0 raised. And so, how do we craft our strategy to fit where that business is at?
Mhm.
And so that gave me tons of exposure to the problems of startups, the problems of CEOs, the problems of technology firms. And ultimately, because of that breadth of experience that I had at this agency where I was employee number one, that was essentially like being that operations experience. We were running our own startup in a sense while serving other startups. And so I got operations experience from being employee number one at our PR firm. I got exposure to technology and kind of product. Well, one, solving our own technology problems, but then two, hearing all these stories from CEOs and CTOs and co-founders about what they're working on. So ultimately, Duett came along. I knew the team that was launching this new software in the home healthcare space, and they had articulated that they were looking for an operator, somebody to step in, even though the problem was identified. They had already built the MVP. In between having the MVP in market and fundraising and building version one, I got hired by the board of Duett to come join the team, take over, fundraise the initial capital, and get version one built, and then get it out into market and start
Huh.
selling it. And so I think the board of Duett realized that I had a wide range of experience to get from zero to something with Duett. Yeah.
Mhm.
So a couple very difficult things to predict is what I mean. I was like, I moved from China back to Indiana to South America, met some people in an elevator, had an interview in a bar along the way. Salsa dancing got me intro to another person. That's what ultimately got me a job. And so that's what I mean. It's like the path written down makes sense, but very difficult to have predicted.
Yeah, little bit difficult to replicate if you're a
Yeah.
student, right?
Yes, exactly.
How many languages do you speak, out of
You
curiosity?
know, I was struggling with this the other day because somebody else asked me this question. I can get myself fed and around cities in English, Spanish, and Chinese. But if it is not ordering food and it is not trying to get directions, you don't want me translating for you. But English is the only language I'm fluent in.
Okay.
Yeah.
So, were you always interested in entrepreneurship, or that's something that kinda came up when you were first exposed to the startup culture in Chile?
I would definitely have to say I stumbled into it. My I do have a family of entrepreneurs. My grandfather, he was a cardiothoracic surgeon here in Indianapolis. Despite being a surgeon and a doctor, he was still an entrepreneur. He owned his own practice. He had some health, medical device innovation in his career. He helped build several devices that are still used in operating rooms to this day. Um, my father is also a surgeon, and he owns his own practices. He started medical facilities that he participates in. My brother, there's a theme here that a lot of doctors in the family. My older brother is a doctor, but also an entrepreneur. He was the one that was hired from a medical standpoint to do the due diligence on Duet. So
Mm.
the team that was kind of tinkering with the idea found my brother through mutual connections. He leveraged his medical degree and his entrepreneurial spirit to kind of do some due diligence on the market, whether or not we should build this or not. And then my wife owns an apparel business. I'm not wearing any of her. Normally, you catch me wearing some version of my wife's company on my body. I'm not today, but she owns a company called Average Athlete. It's an apparel company that tries to encourage everybody to stay on their athletic endeavors and their journey. And
Nice.
then two of my brothers own their own businesses as well.
Wow.
So I know when I was going to school, no, I don't think I didn't have that on my roadmap, but I'm happy to be here, and it's absolutely exciting.
So how much would you say your family background in medicine has benefited you coming into a company like Duett?
So they're absolutely think that this is probably not the answer you're looking for, but it's really funny having my brother be involved in my business. Actually, my wife, somebody out of detail, my wife, yes, she owns her own apparel company, but she is also an MPH, so a master's of public health. And she has spent most of her career actually at nonprofits in the healthcare space. So working either in domestic healthcare policy or international healthcare policy or international healthcare solutions. So actually, my brother and my wife were the market research team that led to the launch of Duett. It's really early on. Now it's my brother and my wife are don't really come to meetings anymore because they're not as involved as they used to be. But early on, it was very interesting having two redheads or three redheads, all with the last name Pittman, show up for meetings as people would look at us like, are you or are you not related? And they were like, hey, to us, it's like obvious. It's like, there's three Pittmans here and we all have red hair. Like obviously we're related, but they would dance around it until they felt comfortable enough asking. So that's funny data point number one. Funny data point number two is having a doctor involved in healthcare technology gets you into rooms you would have a harder time getting into, and it gives you credibility that it kind of comes with some built-in credibility that is exceptionally helpful.
Hmm.
Actually still have some people that I will try to schedule meetings with. And if I send the meeting invite or like the planning email, they won't reply to it. But as soon as my brother follows up as a doctor, they're like, Luke, we'll be there at 9 o'clock tomorrow. Happy to see you. Like, and so obviously those are kind of anecdotal jokes, but
Hmm.
healthcare has always been significant. Healthcare innovations throughout human history have been some of the most important innovations. Obviously, there's some other things that are super, super duper important, but healthcare has kind of changed. Healthcare innovation has changed human history many, many, many times. Now, Duet is a software platform. We're not coming up with new innovative drugs. We're not coming up with new innovative surgery procedures, but we are involved in healthcare. We tend to draw the line between healthcare and social care. Chris, you're in marketing.
Hmm.
You probably coach your clients through this all the time. It's like, hey, if you can kind of like come up with a positioning that helps you explain the difference in a lot of ways, that'll help you. Sometimes it's confusing, but in a lot of ways, it'll help you. So we actually try to say sometimes we're in social care.
Hmm.
Healthcare makes a lot of sense, but when you say healthcare, people think doctors, nurses, pharmaceutical, something like that. We
Hmm.
try to say social care. Not that there's a huge difference, but it helps clarify. We're in healthcare in the way that we're meeting people at their home. We're meeting people where society meets them, which is generally not in the hospital.
Hmm.
And so your question was like having a healthcare background, having a medical background is like, yes, in a my personal branding standpoint as a founder and a CEO, it helps to say like, hey, I was raised by medical practitioners, both nurses and doctors, and our family's been in this space for 70 years. And so in that way, yes, seeing seeing the way that doctors, nurses, other types of healthcare practitioners, the kind of impact that they can have in their patients or their clients or their communities, seeing the difference, the impact they can have absolutely impacted the work that we do now. The other thing that I would say on a personal level is it was a part of your intro, and we will cover this a little bit more when we talk about Duet proper. But my grandmother died of Alzheimer's and a form of dementia.
Hmm.
And the way that I relate to Duet, the work that we do is actually through our family's experience with my grandmother. At the end of her life, because my grandfather's a surgeon, my father's a surgeon, we had the financial flexibility to put 24/7 skilled nursing care around her at the end of her life. So it actually prolonged her life and put her in a position where our family could engage with her more than if she had gone to a long-term living facility or a hospice facility or something like that. And
Hmm.
so in those ways, that's how really being raised by doctors and having nurses around really, and then that personal experience is really what shaped. my experience going into Duett.
Okay. Well, let's dive into Duet then. Can you tell us what is the elevator pitch? You've been at it 5 years now. What are you guys working on? How has it changed since you've been there in those 5 years?
Yeah. Yep. So, what is Duett? I'll use some jargon and I'll try to make it really plain as well. Duett is a referral marketplace between, on one side, we've had social workers, and each one of those social workers has 65, around 65 clients each. We say caseload. So each social worker has a caseload of 65 clients or less, sometimes more. Those clients, we call them clients, but you would also refer to these people as patients. If you were a doctor or a nurse or a hospital, you'd call them patients, but we call them clients or individuals. Each one of those clients has some kind of complex need that would qualify them to be in a nursing facility or an independent living facility or an assisted living facility. But we're using programs to keep them at home in the environment or the environment of their choice, which is typically at home, the place that they have lived most of their life and they want to be there. On the other side of our referral marketplace, we have all different types of home care service providers. Sometimes it's skilled nursing, it can be physical therapy or occupational therapy, but it can also be unskilled labor, like homemaker services. Think light housekeeping, making sure the refrigerator is full of food. But it can also be home delivered meals, home meals on wheels, home delivered meals, chef's kitchen. Those are all types of companies that do home delivered meals for the elderly. But it could also be things like you wouldn't really consider, like pest control or home modification. An individual might get discharged from a hospital and be in a wheelchair or need a walker. And so we're going to go into our vendors are going to go into the home and they're going to install grab bars in bathrooms or ramps to the front door or chair lifts or things like that. So we run on the vendor side of the home care is a wide array of different types of vendors and different types of services. So Duet practically helps manage the referral process between the social workers and their clients and the home and community-based service vendors on the other side of the platform. And so part of your intro there was essentially getting faster results for everybody, accelerate the referral process
Hmm.
for the social worker so they spend more time on other things, get faster results, faster choices for the actual individual receiving care, but also give the home care vendors, one, faster access to referrals, but also a faster way to grow their business. It's a highly competitive market for my users. For us, it's not as competitive. There are absolutely other software companies out there that do things like us or similar, or one part of giant technology companies is referrals, but we focus highly on that referral process. How your part of your other question, part of that question was also how has it changed? So when I started, it was a spreadsheet embedded in a website, and it was like the most basic prototype you can imagine when I say, hey, referral platform. So it started with that MVP. By the time that I was joining, the board and the kind of the original ideators here had created that MVP, and they already actually had users in it. They had about 150 social workers in it. They had about 100 home care agencies in it, and everybody loved it. All the feedback was, this is a huge step forward for our industry. Because prior to that prototype and then prior to what Duett is now, this referral process for the social workers was done by pen and paper, email, fax, phone calls. When a social worker needed to refer a client, and so when I say client, let's make you imagine something real. We've got 65-year-old Sheila Jackson, and Sheila needs 10 hours of nursing care in her home per week so that she can stay there independent in the environment of her choice in her community. If she can't get that care, more likely she has to go live in a nursing facility or an assisted living facility.
Hmm.
That's the problem that we're solving for. How do we give our clients and patients a choice in where they spend the rest of their lives? This process, though, when these referrals are being made on behalf of Sheila Jackson, obviously for HIPAA purposes, Sheila Jackson may exist, but I'm not really talking about a real human being here.
Of course.
You I'm not breaching HIPAA here on a podcast, I promise. This referral was done by phone calls. Social workers would pick up the phone and they'd call as many home care agencies as it took to find one caregiver to take care of their client. And so we've just digitized that process. We've said, hey, a social worker should not be on the phone calling all these agencies for one client when that one client is one of 65 for that individual's caseload. And that social worker is one of hundreds of social workers at our client agencies. So we save those social workers 2 hours per referral, 2 hours worth of work at a minimum per client making a referral. We've since grown to, from our partner organization that we launched Duett with, we've grown to 5 social working organizations. And on the home care provider side, we currently have just over 500 home care agencies using our software for those referrals between social worker and home care agency. We only work in Indiana because of a marketplace. Like, we have had to build marketplaces. And so we find an anchor institution like the social workers, and then we go collect their network of home care providers. So we're only in Indiana, but we're looking to expand outside of Indiana as soon as we can find a partner to launch with.
So, which element of your model is most difficult to bring in new users or new clients? Is it the agency side? Is it the social worker side? Is it the end user or the client side?
Yeah, so it's a great question. I will clarify um, that our users are, as a dual-sided marketplace, our users are the social worker and the home care agency. Even though the client is a part of that triangle, the client doesn't actually log into Duet in any kind of way. They may see some paperwork come their way from their social worker, but they are not logging into Duet. And that, one, from a technology standpoint, that actually streamlines our process quite a bit. We don't have a third user to
Mm,
craft around and to optimize for. But your question being, what's the hardest part to scale, is even though there are technologies, our users are used to technologies. Some of our users use 15 different tools throughout their day.
mm,
So they're used to technology. They're not a technology averse industry. And on the home care agency side, they're actually used to multiple referral sources. So they treat us like a referral source, even though we're really a pass through.
mm,
But they're used to working with all different types of referral sources, all different types of organizations to get new clients, new businesses, new business. So they will take referrals directly from hospitals, rehabilitative, physical therapists, occupational therapists. They'll take referrals from as many places they can get it. And so this is not a winner takes all industry on the home care provider side. Some will use me and 2 to 3 other sources for referrals. But your question, what's the hardest part to scale, is actually on that social work, that agency side, for a number of reasons. But one, we are a little bit an early mover. We're not the only ones, but we're a little bit of an early mover. So we are having to kind of make the market a little bit.
mm,
But the biggest thing is, most of these organizations, all of the ones that I have in Indiana, are nonprofits.
mm,
Most of these organizations nationally are nonprofits. Some are for profit, some are government agencies, they're divisions of a government office. But regardless of where they're parked and what their structure is, uh, they are understaffed, overworked, underpaid, and under budgeted for. And so our biggest thing here is, even though the technology does help make organizations more profitable, or at least more efficient with the dollars they have, that's still a big decision factor for our users, our new customers, to have to make, is like, how are we going to pay for this?
mm,
Now, we know we're working with nonprofits. We know we are working with community-based organizations. And so we've done everything we can from a pricing and business model standpoint to make it the lowest barrier we possibly can. But that is still the barrier generally for our customers. Like, hey, we know we have this problem, but every single dollar and cent is spoken for. So
mm.
how do we carve this out? And so that's a big part of it. Also, healthcare is a complex, it's a everybody knows we've got a healthcare problem, but it's super complex. You're dealing with doctors, nurses, hospitals, for-profit businesses, nonprofit businesses, government, non-government,
Mm.
state politics, federal politics. You're dealing with almost everybody you can imagine, you know?
Yeah.
So
Yeah.
that, not only from a cooks in the kitchen standpoint, makes it complex, but the interconnectedness or the lack of interconnectedness from technology makes it hard to innovate here. And then you just got like, again, going back to my initial point is you got people that are overworked, under resourced, and they're like, I don't care if you make me more efficient. I don't have time to do one more thing in my day. And so healthcare is notoriously difficult because it's complex, whether you're insurance or not, or public or private or not, like it's just a giant ball of yarn that is very difficult to unravel. Now, I say that for context. However, creating efficiencies, improving outcome, creating efficiencies for the businesses, and particularly where tax dollars are concerned, that's a huge motivator. But the biggest motivator really for everybody involved, at least frontline workers, is always, it should always be and tends to always be, how do we create better results for the actual client, patient, and individual? It doesn't always come off that way when we have to talk about dollars and cents and being profitable and scalable.
Hmm.
But the only people that are worth paying attention to in this industry, and that's a pretty hardcore thing to say, I understand, is the people that are patient, individual, or client centric, because it's hard work no matter what, but it's so worth doing when you know you're creating better outcomes for people.
Yeah, absolutely. How have you seen the recent evolution of technology with things like AI becoming so mainstream over the last couple of years? How have you seen that impact the industry, and how has it impacted your business specifically?
Yeah, so it's AI in healthcare is super duper interesting. Like you get 10 doctors or 10 healthcare innovator. You could get 5 doctors in a room and 5 healthcare innovators in a room, and you could have one of the most interesting conversations and about AI in healthcare. I know from sitting in my own webinars and listening to other people talk that, it's absolutely at play when it comes to, like maximizing revenue in terms of, when you talk about how are insurers using AI when it comes to like staffing for nurses, nurses at hospitals, or even in the smaller mom and pop and kind of single shingle businesses when it comes to like actual like home care. AI is being used when it comes to staffing, scheduling, routing resources, resource kind of like making sure the resources are available. That is already at play. That kind of thing is already going on. I think the capitalist in me, I'm actually sitting in one of my client buildings right now, and above me is several hundred social workers that are all working on those clients we've been talking about. Some of the conversations that we have is like, we don't want to dehumanize the work. When it comes to human on human care, human centered care, or person centered care, we use that all kind of means the same thing, but those are the terms that we use. Like, we've got individual clients with sometimes very complex chronic conditions or diagnoses that need very specific things that would be very difficult to do with or without an AI or with or without a human. The conversations that we're having right now are more about like, how do we augment the existing people and what processes can be automated or can be handed off to a machine versus what parts need to be done by a human. If my brother, the doctor, was sitting here, um, I'm quoting him when I say that a lot of concern comes from like who's actually liable for certain types of things. Uh,
Mm.
him being a doctor, right? His attitude about it was, um, more came into malpractice type stuff. Yeah, this might be too heavy of a topic to get into for like 45 seconds, but his attitude was like, hey, I'm going to take any advantage I can get. If it can be helpful to me, I'd like to see it. However, in the healthcare industry, you also understand that ultimately the company, the technology is going to be liable for any kind of outcome. And so that's the part that makes AI in healthcare very difficult, is liability.
Hmm.
And that doesn't mean it shouldn't be done, it shouldn't be pursued. It just makes it another thing that make it very complex. I
Yeah.
do I do admit though that there's a huge opportunity, again, because my users are overworked, overburdened, under-resourced, underpaid. And so if there's any way for us to alleviate that burden, we should absolutely do it because it's critical work for the healthcare outcomes of our actual end benefactors.
Mm.
But at the moment, AI for us is being used in the same way it's being used across hundreds and if not hundreds of thousands of companies across the world, the country, if not the world. I used it to write a proposal the other day. I used ChatGPT to write a proposal the other day. Now it was for a project that we were just throwing at a group of students to react to. I was
Mm.
like, hey, what do you think about something like this? And it helped us kind of get there quicker. That's how Duett is using AI at the moment, is as an augment to our writing capabilities. But serious consideration has to go to AI across the board for the future for sure.
Yeah. And so policy is something that can really impact your business, both at the state and the federal
Yes,
level.
absolutely.
What are you able to do to kind of future proof yourself against shifting rules and policy decisions?
Yeah. So any startup, my advice to any startup is get bigger. One way is to be a weight that would be difficult to move.
Yeah.
That's one way to combat policy shift or policy change. The other thing is it's what you're already doing anyways, which is build build the better solution. Build the best solution you can so that it's undeniable that you should be included in the conversation and included in whatever policy change there is. Now, obviously it's easier to say that than do it. But there are the same way it could be said is more practically what Duett has done is by being really easy to work with, really friendly to one, building for our users. That's actually what I mean is like we
Mm.
build so that we can provide the best solution we can for our users so that our users become our advocates. We're not in a position, this policy has changed for us, particularly in Indiana, but the national federal momentum is going towards encouraging people to stay at home instead of going to institutional living or nursing facilities or assisted living facilities. The national policy and the national trend is to keep patients at home because you get better health outcomes there at the home environment for lots and lots of reasons.
Mm.
You get better healthcare outcomes by keeping your individual at home. Two, and I hate that I follow up that point with this point, it's less expensive for taxpayers to keep people in their homes than go to a institutional living.
Mm.
It's good for the patient. It's good for the taxpayers in lots and lots of circumstances. So the national trend is how do we put policies in place to keep people at home? Indiana recently changed a policy that had detrimental impact on my existing users.
Mm.
What was really cool opportunity for us as an entrepreneur, as an innovator, any type of policy change, you have no choice but to look at it as an opportunity. Some kind of wall is being torn down or some kind of door is being opened where solutions need to fill the gap. It can be people, it can be technology, it can be all types, it can be procedural. So we have no choice but to look at policy change as an opportunity. If you're an entrepreneur, you have to look at it that way.
Yeah.
Now, the policy change in Indiana was very bad for my customers, and we've had to navigate that from a revenue shrinking standpoint, at least in Indiana. But it also created an opportunity for us. It created an opportunity with a class of user, a customer profile that we didn't previously have, which was the insurer. The
Mm.
insurers have come in and have taken up some of that market share. That's an opportunity for me as the CEO of Duett, but it was bad for my customers, my users. It was bad for them. And so we've had to navigate that. And the way that we navigate it with our existing customers is by one, being an incredible resource for them. What do I know? What do they know? How can we work together to help them with their businesses? By building for these customers, by being user focused, we have successfully turned them into our advocates. And so they're going to their policymaker, the people that make policies on their behalf, their own lobbyists. And the meetings that they are having with these people, they're advocating for Duett so that's taking some of the burden off of me and my dollars. The other part of it is like when you're getting into healthcare, there is a game to be played with, unfortunately, with policy. So like, I haven't had to be in a position yet to hire lobbyists on our own behalf, but I've had engaged with them.
Mm.
On behalf of my customers, I provided data to lobbyists. I provided my own testimony to lobbyists on what I think is best as an innovator and as somebody that has kind of a corner of a market. I've been able to participate in that kind of way, which has been super helpful. So to get into marketing though, part of my point is turn your users into advocates, but also turn your perspective and your experience into storytelling. Chris, make your job easier. Storytelling is a huge part of that. Now,
Yeah.
in healthcare, I have the benefit of sitting on a giant pile of healthcare data that tells the story of what does home healthcare look like in Indiana.
Hmm.
I can go to any politician, I can go to any policymaker, lawyer, or appointed official and say, hey, here's what our data says about this industry. We're the only ones. There are maybe two or three other systems that have that data, but their intent with the data is not going to be public, put it to use in a public way. It's going to be optimizing for something else. One way to essentially hedge against policy not going your way is in storytelling. Leverage your experience, leverage your story to drive the outcome as much as you possibly can. And so for us to take that marketing component is helping using both my experience, advocating for my customers, and leveraging our data to tell a story that is good for our users.
Yeah.
Absolutely. So, given all of that, and especially given this change in policy in Indiana, what are your plans moving forward? Are you looking to expand into other states? And what is your ultimate goal, say, for 12 months from now as a
Yeah.
company?
So we've got a couple of things that we're working on, three things that we're working on um, from an expansion standpoint. You said this during your intro. We currently deal with Medicaid clients. And so if the client's not on Medicaid, we don't really have much to offer them from a actually from a function standpoint, we can help anybody looking for home care services. But our tool is really optimized for social workers and the home care agencies for Medicaid clients. So one thing that we're working on is making our product more suitable, optimizing our product for more than just Medicaid. So that could be private pay, it could be Medicare, it could be Veterans Affairs, and I could keep listing these things, but you get the idea. So opening our platform, optimizing it for other funding sources for healthcare, particularly home healthcare. The other thing is taking the existing tool and just expanding outside of Indiana. And so area agencies. So when I'm talking what I have been talking about are area agencies on aging. Everybody in America has a local area agency on aging. In Indiana, that organization is called SACOA. And in Indiana, we have 15 area agencies on aging. Sorry, Indianapolis area agency is SACOA. Across the rest of the state, there are 14 more. In America, in the United States, there are 622 area agencies on aging spread across the country. So we have 600 and what's that? 605 other area agencies that we could go to um, across the country that we could deploy our technology with, and that's probably what takes up most of my time is is dealing with the area agencies across the country. And so that is probably the clearest path of growth for us is how do we deploy this technology with other area agencies. But again, the policy change in Indiana also introduced a new customer profile to us, which is the insurer. Every insurer in America does some version of this work of case management, is what we would call it, when you're helping clients get results that they need. Case management is what you would call that, or service coordination. We can also expand Duett through deploying our technology with insurers. Those can be as large as United Healthcare, but they can be as small as local health plans. And so there are several hundred local health plans on a smaller side that are only in one state or only in one market, one community. We could also deploy our technology with insurers that are our health plans that are doing case management. One of the bigger things for us, because it will serve both our existing users as well as new users, is actually getting into private pay referrals. And so
Hmm.
we started as a B2B solution, but there is a handful of features that we could create that would allow an everyday consumer to come onto our platform and make a referral on your own behalf. So again, going back to our example, or going back to my personal example, is my grandmother at the end of her life had near 24-hour nurses around her at her home. And that gave our family an incredible opportunity to spend more time with her. So we would build a tool that would allow families to do that exact same thing, at least in terms of finding the actual vendor, finding the caregiver to come into your home. That takes an exceptional amount of trust to invite a stranger into your home to care for your family member. But it is one of the things that at the end of an individual's life kind of creates the most dignity, the most independent. It seems strange, but getting care around a person in their own home is actually the thing that typically gives them the most independence at the end of their life. And that's something that we would seek to do.
Yeah, absolutely. Well, I think we can go ahead and wrap up on that one. That's a great bow for this. I really appreciate the time and taking us through your whole journey. It's quite an interesting start that you've had to your journey, and a really powerful position that you've put yourself in here at the end. So, where can people find you if they want to learn more about you and what you're working on in Duett?
Yeah, probably the easiest professionally would be LinkedIn. I think it's linkedin.com/IN/J Cody Pittman. Or if it's not that domain, it's just whatever LinkedIn is /J Cody Pittman. That's probably the fastest way to find me. And feel free to reach out if you want to talk about healthcare technology or anything entrepreneurial or innovation. Feel free to reach out.
Fantastic. And for everyone tuning in, thank you so much for listening. Don't forget to subscribe, leave us a review as it helps with the algorithms. And as always, keep pitching, keep building, and keep scaling.
Thanks for listening to this episode of Pitch, Build, Scale. Be sure to subscribe on your favorite podcast provider so you never miss an episode, and we'll see you next time.